Hey, it's Friday. It's TGIF Doc Talk with Dr. Go. Click the share button to share this episode to a friend or a caregiver and hit follow to keep up with our latest episodes. Thank you.
Hi everyone, today we'll be discussing the differences between geriatric care, palliative care, and rehabilitative care. Now, these words are often used interchangeably in the context of aged care, but there are very distinct differences between each of these terms, and each of them serve important roles in supporting people with certain health challenges, in particular older adults. These patient populations, because they have very different approaches to care. So here I will break down the main differences between these different care concepts. Now, the first one is geriatric care. Geriatric, as the word geriatric means, older adults, typically above the age of 65, and it emphasizes on complex chronic conditions, usually due to aging. And the main goal of this care is to basically maintain the independence and quality of life. So you want to make sure that this elderly person is still enjoying life as much as they can, able to walk around, able to listen to music, able to go to the movies, go to shopping malls, while managing their chronic conditions and to prevent any complications like frailty, falls, or cognitive decline. Now, usually this is under the care of a normal general practitioner or sometimes a geriatrician, which is a specialist in aging. And the most of the care revolves around maintaining their functional abilities, maintaining their cognitive state, and also to help them adjust their medications so that their conditions don't deteriorate too quickly. Now, the second category is palliative care. And palliative care, as its name denotes, it's basically care for patients with very, very serious terminal illnesses. And usually this is illnesses like cancer, kidney failure, heart failure, or certain lung diseases like late stage COPD. And the goal of this care is slightly different. So basically, the main goal is to provide comfort. There is very, very minimal curative hope in palliative care. So the goal is just to make this person as comfortable as possible for the rest of his or her life. And in the context of palliative care, a lot of it involves not only comfort but also psychological support to this individual in accepting the fact that he or she is already near the end of life. So that's pretty much about palliative care. It often involves a lot of pain control, emotional and spiritual support, and a lot of communication and decision-making support with the family members. Now, the third one we come into is rehabilitative care. And rehabilitative care is basically to help someone to recover after a state of injury or illness or surgery. Now, rehabilitative care may apply not only to the elderly population, it could be for people who are even much younger who suffered from sports injuries, motor vehicle accidents, stroke, or even during the COVID pandemic, some young individuals were admitted to the ICU for a long period of time and they became really weak. So rehabilitative care was the main goal for them to regain their independence and physical function. Now, the same goes for individuals who underwent surgery or had a stroke. So the rehabilitative care support basically helps them to return to their daily activities like a normal person and to prevent complications like muscle wasting or joint stiffness. The services often includes a lot of physical therapy focusing on mobility, flexibility and strength, also on occupational therapy which helps them to restore their daily living functions, and also in certain cases, especially in the case of stroke, where the speech therapy helps them to restore their communication function and also swallowing issues. So to summarize everything, geriatric care focuses on normal aging and chronic conditions. The goal is to optimize aging. It's typically for chronic diseases, fall prevention, and it may serve also to extend the quality of life of the individual. Palliative care focuses on end-of-life issues, end-of-life diseases, and usually curative is not the main goal. The main goal is to provide comfort, relief, and emotional support, and also to support with decision making of the family. And rehabilitative care is basically to help an individual, regardless of age, could be young or old, to restore their bodily functions, to regain their independence. And so it involves physiotherapy, occupational therapy, speech therapy, and the main goal is to make this person become as he or she was before the injury. So that's all for today, and thank you for listening, and goodbye. If you like this podcast, please do not forget to like, share, and follow us. Thank you.